Please welcome New York Times journalist Julie Scelfo and panelists Meeta Kumar and Allan Schwartz.
Hi. How's everybody feeling out there? No, really, how are you doing? Tell me, how are you feeling? Okay, good. So now you know that I care about your feelings. And presumably all of the colleges and universities that you represent are making sure that your students know that you too care about their feelings. Because if you're not, then you really are putting yourselves at risk. And I hate to be the one to tell you this news, but a lot of today's students are struggling. And almost all colleges and universities have figured out that they must attend to their students' mental health needs. So what does the picture look like? The best data that we have that measures the experiences of college counseling center directors finds that there are about 54% of serious students. Let me check the number so I say it correctly. So 52% of college counseling center clients are experiencing severe psychological problems, and that's up from 44% in 2013. The college counseling center directors are reporting a steady increase in the number of students who are arriving on campus already on psychiatric medication. 83% of the directors are saying that they're seeing this. And when it comes to what the students are experiencing, the ones that are being treated in the counseling centers, 1 out of every 2 have already been in counseling, 1 out of every 3 have already taken a psychiatric medication, 1 out of 4 have self-injured, 1 out of 3 have seriously considered suicide, 1 in 10 have been hospitalized for psychiatric reasons, nearly 1 in 10 have made a suicide attempt, and 1 out of 3 have experienced a traumatic event. And those are just some of the descriptors. So it's quite a population, and the age of onset for some very serious mental illness overlaps with this very critical time in people's lives. And so the difficulties that college counseling centers face are quite complex. There's a range of students and a range of needs. And so one of the questions that we want to address today is sort of whether schools are adequately finding out the needs of their students, figuring out who needs help, and providing for those needs. So to talk about that, one of the things I thought would be helpful to look at is sort of the experiences at University of Pennsylvania, where in the year 2000, the academic year 2013, they experienced a number of suicides that really were heartbreaking for the campus, as they always are. And so the school put together a task force to examine the mental health of its students, and they came back with a very thoughtful, complex report that looked at what was being done, what areas the school could sort of improve upon. And I was hoping, Meeta, you could tell us a little bit about this.
Okay. Thanks, Julie. Good afternoon. So let me put the task force a little bit in context. So while this was set up in the midst of some really tragic incidents that happened on campus, the charge of the task force was really broad-based and much more interested in kind of the array of mental health concerns that the students deal with. Specifically, they wanted to focus on 3 different areas of concern. One was to kind of really examine the kinds of challenges that affect psychological health among students, review and assess Penn resources. And the third was to really come up with some recommendations regarding policies, programs, and practices to ensure optimal student well-being as well as safety. So that's important, that this was like pretty broad-based in its scope, and the task force took a whole year in just kind of, again, reviewing the various programs at Penn,
and the programs included outreach. There are tables set up during stressful periods. There's a counseling center. There are phone numbers.
As well as the treatment services that we provide to students, and also benchmarking against other national universities, as well as talking to experts. So, in many ways, what they found was that there was such a plethora of different programs and services already in existence. And just to kind of remind, like in keeping up with national trends, we at Penn had already shifted our model of care to incorporate a much more public health way of providing services, keeping an eye on kind of the really more serious issues that students bring in with, but also keeping an eye on kind of general mental wellness issues. They also recognize that we actually have a really great team at Penn. But more specifically, I'm just going to kind of very quickly summarize some of the recommendations, which are really interesting, that they really focused in particularly on kind of certain issues that really exacerbate or create stress for students that have to do with ideas of success and perceptions of success. You know, and kind of sometimes for students, this idea that perfection is effortless, and focus on resilience training. They really emphasized the idea of community connectedness and support.
And Meeta, they created new
students.
programs, including like a student peer counseling center. They also created some programs where they began to train other people in the faculty and administration, sort of to become, not necessarily first responders, but to become aware of warning signs. So I think when I interview college counseling center directors, they're always they're very concerned about their patients, of course, but they're less concerned about them as they are about those who don't even come through the doors. Right. And so, especially when you consider low-income students who maybe aren't exposed in their communities to having outside resources, or their families are not necessarily encouraging this kind of talk, they don't
really
know.
Having kind of a model of shared responsibility, and I'm glad you bring up faculty, which I think were a specific focus of the task force, really recognizing that there's such an interplay between mental health and academic issues, and really including faculty in really serious, you know, campus-wide ways to really develop, you know, frameworks, language, and understanding of the different resources that are available, that they can really engage and talk to students in different ways.
Yes, and one thing I think, you know, that drew me to Meeta's work, and she probably wouldn't even tell you this, but they have so many programs that they need people to coordinate all the programs. So Meeta is one of those people, and one of the recommendations in the task force report was to create a central phone number that a concerned parent or a friend could call to put them in touch with the plethora of programs, doctors, all the different kinds of resources that are there. But I wanted to raise a question that may be a little sensitive, which is, are schools doing enough? You know, healthcare, mental health care specifically, didn't used to be the province of colleges and universities to deal with. And when I went to school, maybe there was one psychologist on staff who would consult once a week. And 10 or 15 years ago, when I first started reporting on what was being called the mental health care crisis on campus, it was amazing to see how colleges and universities have adapted and expanded their offerings, built large centers, have all different types of programs that work to provide services. So, you know, I kind of wonder, are you all doing enough? And does somebody need to say, look, this is a larger problem that doesn't belong to the universities? Or also, are we overblowing the problem? Maybe Dr. Schwartz, you could talk about that.
Well, one thing has gotten pretty clear to me, and that is that institutions of post-secondary education are needing to cope with some changes that have taken place over the last very long while, my perspective being about 50 years, going back to the 60s, at a time when in loco parentis responsibilities were relatively minimal, and that adjustment includes dealing with a population of persons now at the undergraduate and the graduate level who are used to getting whatever they want, whenever they want it, 24/7. That whether it's money that they get from an ATM or TLC that they get from some source like a counseling center or an online service that provides screening devices and maybe protocols for how to proceed to deal with their depression or their anxiety, it's an expectation which is hardly irrational on their part given their experience. And it's something that counseling centers are really having a struggle dealing with.
I hear this from people I talk to in schools all over the country, because students are coming in asking for help managing stress and anxiety about what most of us in this room consider everyday life. And these are things that, we struggle, we all grow up and we experience struggles, but a lot of these children are growing up from what we have called helicopter parents. And I wrote my last piece about how we call them now lawnmower parents. They mow everything out of the way. And Meeta was telling me earlier that they have a new name.
Snowplows.
Snowplows. So, this is a population of students that has been coddled, they've been overindulged, and they don't have necessarily the resilience that they need. So I don't know. I mean, should the mental health community, is it appropriate for the mental health professionals at the schools to start getting involved in the other departments of the schools and saying enough is enough? The cost of tuition is so high, it puts incredible pressure on students and their families, which then comes back to affect the students even more. The incredible disparity of wealth in this country is creating anxiety and pressures that we're seeing not just in college students, but even increasingly younger and younger children. So there's many issues that contribute to this. Dr. Schwartz, are there other things that you want to bring up that you think are sort of the best innovations? I mean, I remember, for example, 10 or 15 years ago seeing a hugs and kisses booth on campus that they set up during exams, and they were providing hugs and giving out chocolate kisses. And that wasn't really what they were doing. What they were really doing was passing out pencils and stress balls with the counseling center number. That way, hopefully, the one or two students who were in distress would know or be able to find out how to reach out. So that's what they were really doing. But are there other things that schools do now that you think more people should know about?
Well, context. The popular press, understandably, is highlighting features that are real, but I don't think capture the fundamental reality. There is no safer place than a four-year college or university campus for your son or daughter, whether it's with respect to vehicular death or accidents of other kinds that cause death or suicide or homicide. There is no safer place than a four-year college or university campus. So keeping that in mind, and without minimizing the fact that there's a lot of distress being expressed, there's a real disparity between what the perceivers of that distress, the staff and directors of counseling centers, see going on, and what the students themselves tell you when you ask them the same questions you've been asking them for the last 15 or 20 years. Their answers to those questions are unchanged. What has changed is expectations about responses to their distresses.
And there's
I
also
think
a lot of
that's
fear,
challenge.
right?
That's a challenge that we have not yet succeeded in meeting at a level that we need to.
I think that's an enormously important point, and also because there's just so much fear that we all have now. It's just like when television started operating 24 hours a day, suddenly you didn't just hear about the local crime, you heard about every single little crime all over the country. And when we're exposed to that 24 hours a day, and you're exposed to that information in elevators everywhere you go, it creates a heightened sense of fear and anxiety. And now we have this sort of countrywide, and we have students who are very nervous about their future, and we have parents who are anxious about paying for it, and there's a lot of anxiety. But as Dr. Schwartz points out, attending college, any kind of college in fact, is actually a form of protection in a sense against suicide, because the suicide rates among college students are actually lower than suicide rates of their same aged peers who do not attend college. So certainly we all appropriately should be concerned about students, who succeed or attempt suicide on campus. But the mental well-being of all these students, I think, is another source of concern.
And I'd say it's important to add a wrinkle here. The fact that suicide is a less prominent source of mortality on campuses has been known now for a couple of decades. It is the least protective against suicide. That against vehicular death or against accidental death of other kinds, and by a factor of nearly 100 against homicide on campuses. campuses are safe places. And those are the 4 leading causes of death in this age group, accounting for 80% of all deaths. So I think as we look at the challenges that counseling centers face, it's worth keeping in mind that colleges are in many senses great places to put your son or daughter.
Yeah, so I wonder if I can pick that up a little bit and talk about, I think we're aware of the rates of suicide, but the impact of even one, just given the ecology of a campus community, is devastating. And many times it's really difficult to find the balance between the complex emotions that a suicide evokes and the facts of the situation. And also then keeping an eye on kind of the general wellness of the student body, just given the, some of the data that's coming out of American College Health Association, just talking about the stress and anxiety that college students report feeling, and again, the interplay between that and the academic performance and academic journey. So, going back to your point, Julie, you're talking about innovations. This year, something that we launched at Penn was an online wellness module mandatory for all incoming freshmen. And it's interesting, we don't really talk so much about mental health per se in the module, but it's a lot of just resilience building kinds of ideas around what success means and what social norms, what are some pervasive social norms that are likely to create some stress for students, expectations around grades, and just sort of like a tolerance of normative distress coupled with just the idea of seek help.
And I think that's the trend where we're going to begin to see more and more in students before they go to college. Certainly, a lot of schools around the country are increasing their concern and their demand for what's called social and emotional learning, which is actually not unlike the things we deal with in mentally ill people we consider mentally ill, but it's sort of the reverse, the preventative approach of providing the set of skills they need to cope and adapt and deal with everyday life challenges.
I think we have time probably for just one question or
Sure.
comment from the audience if anyone had a question that they wanted to ask the panel or experiences that they've had dealing with mental health issues on their own campuses. One of the questions that came in was how much we should be thinking about this in terms of substance abuse. When students are coming to campus, when they're dealing with issues of, for the first time, being exposed to alcohol, being exposed to recreational drugs, how much of our intervention should be structured around dealing with substance abuse versus mental health issues that are independent of that?
I mean, the DSM, which sort of categorizes mental disorders, increasingly has been viewing substance abuse as a symptom of an underlying issue of depression, of anxiety, of a number of things. And unfortunately, there's data suggesting that fewer students are getting treatment for substance abuse, and that more students are beginning to self-injure, and also there's an increase in suicide ideation. So I think substance abuse is part of the equation. Do either of you want to?
Dr. Kumar, do you?
Yeah. So I think it's definitely part of the equation where I think you have certain comorbidities that we call, where you may have mental health issues that intersect and exacerbate and cause, more sort of substance use. We are finding more and more students coming to college with prior histories of engaging in substance use.
And also on prescription medication.
And also of prescription medication. So some of it is recreational, some of it has interplay with mental health issues, and there's always efforts there towards harm reduction and keeping an eye on safety and emphasizing, where sort of like drinking use sort of intersects with just general stress that students experience and mental health issues. So there's always sort of conversations trying to focus on kind of the continuum,
Very interesting. Thank you so much. We really appreciate your time. Let's thank our panel. Thank you so much.
Thank you.